Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about how one local health system has been able to test for COVID-19 and the amazing work that they're able to do in their laboratories. Our guest today is Michael Eller, the AVP of Northwell Health Labs, and Chris Zavala, the Director of Business Development and Marketing for Northwell Health Labs. Michael and Chris, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you very much. It's great to be here, and thanks for having us.
Yeah, very excited.
Welcome, both of you. So first, tell us, how have you personally been affected by COVID-19?
I think we've all been affected in one way or another. On a personal level, my two of my kids had it and did very well. So thank goodness for that. And I think we're all just, kind of trying to get used to this new kind of normal, as they want to call it.
Yeah.
And it's been a little crazy. We're working hard, putting in a lot of hours, a lot of time and effort, and in the fight.
From my perspective, I live alone, so it's been very, it's been easy to social distance for the last 3 months. But work has really taken it's taken a lot of time out of our day. We've been pretty much working 7 days a week, almost all hours of the day, trying, especially at the start of the pandemic. So it's been a rough, a long three months or so.
I can understand that, and for everyone probably who is listening, including myself. So tell us about the amazing efforts you and your team at Northwell have done when it comes down to testing for COVID-19. How many tests do you do per day? I know you're doing it in March. How many do you do on a daily basis?
Yeah, that's a good question. So there's several types of tests for COVID. There's a diagnostic PCR-based test, a molecular-based test that tell you whether or not you're actually infected with the disease today. We do we have capacity to do about 5,400 of those tests a day. So that's a fair amount of tests.
Wow.
And there's the antibody test that everyone's talking about, and those tell you whether or not you were exposed to COVID-19 in the past. And right now I think we're up to about we could do about 20,000 a day. I think at this point we're probably doing about 10 to 12,000 a day. So we have capacity to do more. But those are the tests that we have today.
The testing that you are doing, you spoke about the antibody testing as well as the swab testing that you do. Tell me the differences in the two. The nasal swab that you do, how do you differentiate between the tests? The
PCR-based test is done by taking what's called a nasopharyngeal swab, which it's a simple procedure, but kind of uncomfortable for the patient, where you take about a 6-inch sized long swab, and you insert it into the nasal passage all the way back, basically till you feel you hit something, if you will. And that is used for the PCR-based test. You could also do nasal swabs, which are not as invasive, doesn't go quite as deep. However, you lose a little bit of sensitivity on those by that method. So the preferred method is a nasopharyngeal swab. And the antibody testing is just a simple venipuncture. We take a vial of blood, bring it back to the lab, and run the test.
So between the two, what is preferred? And what would you suggest being done if you have a person who is feeling as though they may be positive for COVID?
So yeah, it really depends. I think you hit the nail on the head. It depends. They're both for different purposes. The PCR, the swab that Mike was referring to, is more of a diagnostic test. So if you're feeling sick and you think you may have COVID, if you have the symptoms of COVID, your doctor is going to probably suggest you get one of those tests. The antibody test is more to tell you if you've been exposed over the course of, the last couple months to COVID. So that's really the main difference.
So if you have someone who is suspecting that they are positive COVID because they have respiratory symptoms, what would they expect if they're coming into the hospital or to a Northwell related facility? What can they expect to be done? The nasopharyngeal, the PCR, or the antibody test?
They would most likely get the nasopharyngeal swab for diagnostic because they are symptomatic. So we want to know, do I have COVID-19 now? Is this the cause of my symptoms? And that test will tell you whether it's the cause of your symptoms.
And how long does it take for us to get a result of that PCR?
So we're resulting most of them within 48 hours, 48 to 72 hours. But it's really dependent on our the incoming volume. So over the last couple of months, there's been issues with supply chain. So we've seen it vary between 1 to 2 days to 3 to 5 days when our volume has really spiked at the peak of the pandemic. But right now we're about 1 to 2 days.
So I know that there's sometimes when you do diagnostic tests, false positives. Are you seeing that where you may have a nasal swab and it is wrong in terms of its result, that it's negative, but the patient really does ultimately have the COVID virus?
Yeah, these tests are pretty accurate. We're talking like to the 99% sensitivity. So positive, if you're positive, you're positive. You usually don't get false positives on these tests. You do run the risk, however, of depending on how the sample's collected, of a false negative. So if you have a specimen that's not collected properly, you could not have picked up enough of the virus to get a positive test. But that's pretty rare in these tests. So we're very confident. In the PCR testing, it's a good test, proven.
And also back to what Mike was saying earlier, a nasopharyngeal swab is really the preferred method because it has the highest sensitivity. If you choose to do a nasal swab for any given reason, the sensitivity goes down. So that could also be a reason you get a false negative. But again, it's a very, very sensitive assay. You
are both from Northwell. Where are there sites for testing?
You can get tested at any of our patient service centers. We have 30 plus patient service centers all around the 5 boroughs, Long Island area. So if someone does want to go get tested, they need a request from their physician, and they can go to one of those patient service centers that they can find on northwell.edu/LabFly.
Labs. Northwell.edu/labs.
/labs. Sorry about that.
That's okay.
So say that again. What is it?
Northwell.edu/labs, LABS.
Okay.
And what we are telling patients that if you're feeling symptomatic, and they'll talk to their physician, and I think their physician would agree that going to a patient service center to get tested isn't the right place. They should be going to a Go Health urgent care or an emergency room or getting a test done with their physician in their office. We want to try to keep symptomatic people out of patient service centers. If you're asymptomatic and for whatever reason your physician wants you to have a test, and that could be preoperative testing, so you're going to have surgery, so it requires a COVID swab before testing, then that's a good environment to do, is go to a patient service center or one of our pre-surgical testing sites to get tested.
So can you tell us about the LabFly at Northwell Health? What is LabFly?
Sure. So LabFly is a app where you can request the phlebotomist. So a long time ago, some people here had this great idea using like rideshare apps that, why can't we do that in laboratories? There's always these types of consumer-friendly apps where it's all about convenience. And in healthcare, just in general, we find that it's not always the most convenient thing. You have to make an appointment, you have to wait. So instead of going to a patient service center, we figured that we could have a phlebotomist go to your house, and you can request a phlebotomist at any given time of the day. So that basically, I'll walk you through how the app works. So if you go to your doctor, the doctor says you need to have this blood work done. They give you a script. Normally, you go to a patient service center, but let's say you have kids, or it's more challenging for you because you're busy working. So you can go on this app, select a time. You create a profile first. Put in your insurance information. You select a time that works for you, and you can have the phlebotomist come to your house. It'll actually track the phlebotomist to your house. After the collection's done, it'll ask you to rate the phlebotomist, and there's a small convenience charge that goes along with that. But people actually love to use the app for themselves, and especially if they have young kids, they've been using the app pretty regularly because it makes it very convenient for their children to keep them in a comfortable space while they're getting their blood work done.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about COVID-19 testing, a new service called LabFly at Northwell Health with Michael Eller, the AVP of Northwell Labs, and Chris Zavala, the Director of Business Development and Marketing for Northwell Health Labs. So let's just continue talking about this app. So this app is really specifically for the phlebotomist, I guess, to come to the home to do antibody testing.
But you can use LabFly to get any blood work done at your home. So not just antibody testing, and you could also get the COVID swab done
wonderful.
At your house as well.
Mm-hmm.
We trained our phlebotomists to do that.
So like for going back to your previous question about if you have symptoms, you think you may have COVID, you call your doctor, you get an order. If your doctor wants you to get collected, you can also even go on the LabFly app and order the phlebotomist to come to your house to do the collection at your house. So you don't even have to leave your home.
Where do I find this app?
It's in the app store, like the Apple App Store, iTunes, or Google Store and Google Play.
Wow. And how long has this been available?
We went live in August. I think it was August 26th was our go live date, and so we had a slow and deliberate ramp up. So we make sure we work out any kinks with the app and make sure it's working properly. And we were doing about 20 or 30 LabFly collections a week until COVID hit. Then naturally, as you can imagine, the demand skyrocketed to where we're doing about 260 of these collections a week. So the volume has gone up tremendously because the strategy with this pandemic is to keep people home. And if we can do as much healthcare we could do at home, the better things are going to be for the pandemic. So it just so happened that we came out with LabFly right before this pandemic, and we're actually very lucky and fortunate that we did, so we can really contribute to keeping people at home where they can't spread.
So is there any cost to use LabFly, and is it covered by insurance?
So the testing itself is covered by patient's insurance. We charge a $20, $19.99 convenience fee to use LabFly. So, which most patients, the $20 is you'll pay $10 to get Taco Bell delivered. I would definitely pay $20 to have someone come to my house to draw my blood. In addition, the app will also point you to one of our patient service centers. So if you don't want to pay the $20, you could use the app to make an appointment and go to one of our patient service centers.
And one of the other great things about the app is that you also get your results on the same and that same app. So like for a couple of days after the results are completed, you'll get the results on your phone as well as the physician will get their results, however method they normally get them.
Well, that sounds great. So can people also get this LabFly to come to their home, office, school, wherever they are? Or is it just home-based that the phlebotomist comes to the home?
It's a great question. We really send the phlebotomist wherever they are, but it has to be in a private location.
Mm-hmm.
So if it's somebody's workplace, it'd have to be like in a private office. If they have an office they can use, we'll go there and collect the sample from that location. So it really depends on the circumstance of the patient.
This sounds like it's opened up a large opportunity for healthcare workers looking for employment, particularly those people who you hire as phlebotomists.
Yeah, that's absolutely right. So the pandemic has really pushed a lot of just office visits, medical office visits to the home, and to telehealth visits.
Mm-hmm.
So because of that, doctors are seeing patients through telehealth, and they don't have the opportunity to draw those patients in the office. So that's why we've seen a very large spike in LabFly, as Mike was alluding to earlier, but also our so just our home draw business in general. We've been trying to hire since this pandemic, hiring in that department to make sure that we can keep up with the demand, because right now we just have so many requests coming in that we really want to be able to offer this service to anybody who wants to use it in our service area. Right now we're in Long Island, all of the boroughs, and Westchester. So we want to make sure that if anybody needs an appointment, there's availability, and that we'll be able to give them the best services possible.
So what is the qualifications for someone who fulfills this role of an individual who comes to the house to draw the bloods? Is this a licensed individual, and what is the license requirement?
Actually, the individuals are not licensed. Phlebotomist is not a licensed profession. So there's really minimal educational requirements to be a phlebotomist. But the training is extensive. So individuals can go to a training program where they go and get trained to be a phlebotomist. They're observed doing so many sticks. But it's not a licensed profession.
But I want to say on that regard, like phlebotomists, this is what they do every day. So you'll have some phlebotomists that draw, not necessarily home draw phlebotomists, but nursing home phlebotomists that they draw 100 patients a day. Sometimes they between 50 and 100 patients. They're like very skilled in what they do. Mm-hmm. We often have a phrase in the lab that they can draw blood from a stone, because they're really skilled. They do a really great job. And their bedside manner is like impeccable. We get the greatest feedback from our phlebotomists that we have here, and we're really proud to have such a great team here at Northwell.
So you do look for experienced phlebotomists.
Preferably, we'd like to have experienced phlebotomists. Absolutely.
So I'm thinking about the older adult who may be in the community where you have a phlebotomist coming from Northwell. What do they come with any kind of ID when they knock on the door to come into the home? Do they have to present a certain ID?
Yeah, they all have their ID badges from Northwell Health. They're uniformed. And if patients use the LabFly app, they will actually see a picture of the phlebotomist that's coming to their home, just like
that's safety mechanism. Mm-hmm.
Yeah.
And they'll also see the name of the person that's going to be that they're opening the door to, and a picture of them, so that way they know that Mike Eller is coming to the door, and they'll see what he looks like before he even gets to the door, so they're not confused or they think that's somebody else.
So all said and done, how long would this take for everything? Would it be 5, 10 minutes, half hour for this whole procedure to be completed once they enter into the home?
Typically, blood work will take 5 minutes, 10 minutes. Mm-hmm. It might take a little longer if they're doing a nasal swab, because they completely gown up in PPE. So they'll pull up to the house, they'll go to the front door, and then outside they'll put their PPE on. And then come in and do the procedure. So, it takes anywhere between, 5 and 15 minutes.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're talking about COVID-19 testing, a new service called LabFly at Northwell Health, with Michael Eller, the AVP of Northwell Health Labs, and Chris Zavala, the Director of Business Development and Marketing for Northwell Health Labs. Well, getting back to COVID-19 testing, I know that Northwell has been working with Governor Cuomo to open test sites across Nassau County and the city and churches and other non-conventional sites. Can you tell us about those and if people have been taking advantage of them?
Yes, so we've been working in partnership with Governor Cuomo's office for opening testing, antibody testing and diagnostic PCR testing for COVID-19 in lower-income communities through their houses of faith, so a lot of churches throughout the region. We've been doing that for the last 3 weeks. We've tested over 20,000 people in those areas. We go at these churches in the morning and there'll be a line around the church, almost 100 people deep. It's really incredible. And the feedback that we've gotten from the community has just been very positive. And we're really happy to partner with the governor's office to provide the service to the community.
So what is the difference have you seen from March to April in terms of the infection rate based upon the lab results?
Well, from March and April and even into May, the rate was very high, and a lot of it is depending on where your source of your data is. So our hospital patients at one point, I believe it was in March and April, we had 70% of the patients in our hospitals were positive. I had to look at that number a few times because it just seemed overwhelming to me. But now I think at this point we're down to about 2% positivity. So it shows the really the great work that New Yorkers have done in following the guidelines, social distancing, wearing their masks, in order to get that infection rate down. So it's wonderful to see us going in the right direction.
What do you think about people repeating tests? Say they went for a COVID test yesterday and then the following week they have symptoms. What are your thoughts about repeating the test?
That's a good question. And, I think that they need to really consult with their physician. If their physician thinks based on their symptoms that a repeat test is warranted, then by all means, I think they should have the test. Sometimes, especially in the beginning, someone with just this, pretty non-specific symptoms would want to get tested, and then they're negative, but then 2 weeks later, oh my God, now I got these crazy symptoms that, and to not test them would be a disservice. So I think it needs to be a decision made in conjunction with an individual.
There's still other respiratory viruses out there that have similar symptoms. So just because somebody has same symptoms of COVID doesn't necessarily mean they have COVID. They could have something else. And when this first started happening at the beginning of March, we saw a lot of cases of influenza as well. Mm-hmm. There's definitely other things out there that could cause you to get sick. And if your doctor thinks you should get tested, you should definitely get tested.
So if I use LabFly on week 1 and I want to be retested on week 2, it's still the same $20?
Yes.
So every time I call LabFly, it's just $20 for them to retest me.
Exactly.
It's $20 per visit, but let's say if it's you and your kids, it would be $20 for up to 3 people in your household.
And can kids be tested? What is the age? Is there age range for the testing?
We typically, we'll go down to the babies, 1 year old. We have a lot of phlebotomists that are really skilled at drawing young children. So those are typically the phlebotomists that will assign to those cases because they're the most, most experienced. Mm-hmm. We do lots of kids.
And so have you found that kids are coming up positive as much as the adult population? Or is it equal in your findings?
Yeah, I don't have that data.
Okay.
I know, anecdotally and from some of the observations and things that we've seen is that children tend to have a lot of less symptomology than adults. Mm-hmm. Just on a personal note, I had 2 of my children were positive, and one of them was symptomatic, and the other one was not, and no symptoms at all. So we're seeing that a lot, that younger children tend to exhibit less symptoms.
So if one of our friends listening wanted to get in contact with you for any information about LabFly, etc., what is the best way to reach you?
So we have a LabFly email address that is the best way. It's LabFly, LABFLY at northwell.edu. And that would reach us and our team. And if they have any questions or want questions about the app, they can get the most information just by going to that. We also have a website. It's northwell.edu/LabFly, and they'll get a lot of information there as well. So those are two. You can either reach us directly, us and our team, or go directly to the website where we have a lot of material there.
Well, one last question. If I have an affiliated physician who works for Northwell, are these results automatically uploaded to the system that he or she can see the result of my COVID test, or is it something that I have to take to my physician, the result of the COVID test?
That's a great question. So the lab is a little bit unique in Northwell because we not only service our Northwell physicians, but we service a lot of physicians in the community. They use our lab services. So we have accounts set up with a lot of community physicians that are not necessarily Northwell affiliates. So if we have an account set up with those clients, they will get the results back however means they have set up. So a lot of them have direct interfaces with their EMR, their electronic medical record. So those results will go right back to them. If they don't, some other offices will have automatic faxes that they get daily. And then those physicians that have never used our lab before, we have a process in place to get those results back to the physician, either through mail or through a courier delivery service. They'll get the results. They'll definitely get the results back to that physician. You won't have to worry about bringing that result to your physician's office.
Great news. Okay, thank you for being here, Michael Eller, the AVP of Northwell Health Labs, and Chris Zavala, the Director of Business Development and Marketing for Northwell Health Labs. We hope you stay safe and continue to do great work for Long Island and its surrounding communities.
Thank you for having us.
And this is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. And I want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.